are these people?
Speaking of the Biden administration and all this fake shit, like he's doing well.
Yeah.
Like he's exceeded my expectations. That's the
Yeah.
talking point that we're hearing. Well, check
You
this out.
fool!
So, oh, where's that from?
Gilbert Gottfried.
Yeah, that's
Yeah.
new.
That's from Hollywood Squares. You fool. So
Haven't read them in a minute. Common Dreams. You all know that's generally my go-to. Jake Johnson reports rolling Medicaid purge called largest concentration of health insurance loss in U.S. history. Let that sink in, sir. Like,
yep.
largest concentration of health insurance loss. One activist warned that this is going to be become the healthcare legacy of the Biden presidency if his administration doesn't act, which we know he won't. But this won't be talked about that much, which is why we're going to do it right here. And anyone who can tell you, oh, Biden's doing a great job or all this kind of bullshit, you can send them this clip and kind of prove otherwise. But anyway, Jake Johnson writes, states across the U.S. has stripped nearly 6 million people of Medicaid coverage just the past several months, creating what one healthcare activist and researcher described as the largest concentration of health insurance loss in American history. This is happening in red states like Texas, Utah, or Idaho, where we expect this brutal Medicare retrenchment. Beatrice Adler-Bolton, co-author of Health Communism and co-host of the popular Death Panel podcast, said in a statement on Friday. But there are huge amounts of procedural disenrollments happening in California. It's happening in Rhode Island and California and New Mexico, noted Adler-Bolton. This is a year-long process, and it's just getting started. It's moving slowly, and it's more dangerous this way. The process is rolling, so the data is slow. We're not going to have a full picture of how to compare states against each other for months and months. So yeah, it sounds like we're not going to get the full scope of this until God knows how long. I would argue, assuming Biden is not the president come 2024, but watch what's going to happen if we get Trump back in. This will stay, and people will kind of throw this at Trump. Oh, you're the cause of this.
Yes.
Like, watch what that's like.
Obama put a ton of tanks on Russian borders and, expected Trump to do something about it,
Right.
So, same difference.
The latest data compiled by KFF, which includes publicly reported figures from 48 states and Washington, D.C., shows that at least 5.7 million people have lost Medicaid coverage since April. And just to give context, that's when the pandemic ended officially. When states began eligibility checks and disenrollments that were paused during the coronavirus pandemic.
Right, so coronavirus is over, and give us our motherfucking money.
Right.
Okay.
A bipartisan deal reached by Congress and approved by President Joe Biden late last year lifted the pandemic-era continuous coverage requirements that prevented states from kicking people off Medicaid during the public health emergency. The policy led to record Medicare enrollment, and its termination could cause upwards of 15 million people, including millions of children, to lose coverage under the program.
Nice.
So, fuck them kids, I guess.
Yep. 15 million people with an M. That's a lot of people. That's 1.5 billion, right? We're gonna do math. I like how they rounded it down to millions, though. So, yeah.
According to KFF, 73% of the people disenrolled from Medicare so far have lost coverage for procedural reasons, such as failure to return paperwork on time or jump through other often confusing bureaucratic hoops, not because they were deemed ineligible due to their income or other factors. High procedural disenrollment rates are concerning because many people who are disenrolled from these paperwork reasons may still be eligible for Medicare coverage, KFF explained earlier this week. Some states, such as Maine, have temporarily paused procedural terminations for some enrollees, while the states address problems in the renewal process that lead to increased procedural disenrollments. Many of these individuals did not receive any notice of denial, leaving them unaware of their coverage termination. Jesus
Nice.
Christ.
So, yeah. Great.
Texas has removed Texas has removed more people from Medicaid than any other state, disenrolling around 617,000 in just a few months. Late last month, the state's entire Democratic congressional delegation implored the Centers for Medicare and Medicaid Services to intervene and ensure that Texas Republican-dominated government complies with federal rules to prevent the catastrophic loss of coverage. The Democratic lawmakers, led by Representatives Loyal Doggett and Greg Caesar, cited a July whistleblower letter that issued dire warnings about Texas's Medicaid purge. The whistleblowers, who identified themselves as employers of the Texas Health and Human Services Commission, wrote that roughly 2 weeks after the mass disenrollments began, we started receiving numerous emails from agency leadership indicating that thousands of individuals had been erroneously denied coverage. As a result of the initial process we ran in April, we are informed that approximately 80,000 individuals lost coverage erroneously, including several thousand pregnant women who required critical services during their pregnancies or essential post-pregnancy care coverage, the whistleblowers wrote. Additionally, we received subsequent emails from agency leadership indicating that several thousand elderly individuals were slated to lose medical coverage, which previously paid a portion of their Medicare Part B expenses.
Yep.
Many of these individuals did not receive any notice of denial, they added, leaving them unaware of their coverage termination until their social benefits were reduced to cover the premium payments. Shortly after the whistleblower alleged allegations emerged, CMS sent letters to all 50 states noting that it had learned of additional systems and operational issues affecting multiple states, which may be resulting in eligible individuals being improperly disenrolled. One problem identified by CMS could be having a disproportionate impact on kids, the agency said in a statement.
Oh, it definitely will.
CMS believes that eligibility systems in a number of states are programmed incorrectly and are conducting automatic renewals at the family level and not the individual level, even though individuals in a family may have different eligibility requirements to qualify for Medicaid and the Children's Health Insurance Program, the agency said. For example, children often have higher eligibility thresholds than their parents, making them more likely to be eligible for Medicaid or CHIP coverage even if their parents no longer qualify. Sounds like, what was it? The child tax credit,
Yeah.
basically. Yeah, it's great that children get that tax credit, but if the parents are poor,
Yeah. Good luck.
what much of a difference is it going to make for the kids, even though they get a little bit? So take care of the family, you take care of the kids. But anyway, speaking on the condition of anonymity, one Biden administration told the Washington Post that the number of children affected by the programming issue is likely in the millions. CMS has also warned that long call center times in at least 16 states could be causing people to give up on trying to renew their coverage. While Republican-led such as Texas and Florida have moved aggressively to gut their Medicaid rules, drawing outrage and lawsuits from residents, California, New York, and other blue states have also collectively removed hundreds of thousands of people from the program, often for procedural reasons, indicating a nationwide crisis. Adela Bolton warned Friday that this is going to become the healthcare legacy of the Biden presidency if his administration doesn't act quickly. When we look at the Affordable Care Act enrollment expansion, 13 million people added in 2014. We're going to see a contradiction of a similar amount, if not 10 million more, in the course of a calendar year, said Adler Bolton. CMS has the authority to halt procedural determinations today. We're only a few months into this, and 74% are procedural determinations. CMS should be saying pause. It's their responsibility to do it.
Well,
thanks, Biden.
Yep.
Come on, man. Give me a little break here.
Well, his legacy is going to look real great, and that also
Well,
ties to
is
Obama's
it though?
legacy. So,
well, is it though? Because people are not talking about this.
no, because they don't
think
know. They have no
right.
idea.
I think JB has talked about this. I think Sabby has talked about this story maybe a few weeks ago. But yeah, like this is a huge deal, especially given the fact that this involves children, and which is obviously given my job very close to my heart. Can you pull up that
Yes.
that you just did?
Yep.
Sorry. So Google said my daughter basically lost her insurance as soon as COVID-19 was over. Medicaid, bunch of BS. Yeah, I'm sorry to hear that.
Yep.
But
I also saw. I think it was. If I scroll up a little further, where's it at? I'm looking. It was someone saying that their mom wasn't getting their PT for the same reason that she actually needs. So bad bread and circuses. Looks like more people going without insulin and climbing healthcare debt. Yep.
yeah.
So
Like I mean, I said this months ago. Like once the pandemic was over, if you still had medical debt, like I think they will kind of chill on that for the last. And trust me, I know because I went through the same shit during the pandemic. Like they will start collecting on them, and I'm pretty sure they started to, and that's putting people in the bind. So yeah, and again, this is the shit that is not reported about at all, but Joe Biden is doing a good job. So I will say this though, one positive that I'm thinking about in terms of this, like this is the beauty of me working in local politics, because a lot of the stuff that I talk about here, I think just naturally when it falls through, like I can kind of use that as activism locally in DC. You know this, but I went to my organizational meeting for the group that I'm part of last night. There's actually, and I'm not sure if I should even say this, but I'm going to say it anyway. For what I understand, there is potentially a bill that is being created in DC to reinstate the child tax credit locally here. So right now we're going to do research in terms of what that will look like if that were to happen. Definitely one of the things that I'm thinking about after reading this article, like the one thing that I kind of mentioned last night, number one, make it universal. Like even if it's for a rich person, you may want to, and this is something that we have to kind of look at, you might want to give it on a sliding scale depending on income, but make it available to everybody is essentially what I'm thinking about. But then the other thing is, again, with this article, I'm just thinking about kids because, like, honestly, like with the child tax credit, like for many people, and I'm going to be doing the data like through the fall just to kind of see if families had a child credit, what would they do with that money? And one thing I said was childcare, but I'm fairly certain now, thinking about this, maybe for some families, healthcare as well. So that's definitely something that I am thinking about. And by the way, fam, like I'll probably will talk more about this as I pull everything together when I start collecting this data next month. I'll probably will ask you guys too. Maybe we can make that a segment. Like as far as if you are a parent and you had X number of money for a child's credit every month, what would you spend that on? It's essentially what I'm thinking about right now. But yeah, I think, yeah, it just shows like a lot of this typically, not surprisingly, is bureaucracy, just in terms
Yeah.
of paperwork
Well,
is
it's like-
hard, people don't give it on time, everything is backed up, that people lose their coverage.
As someone with
So
severe ADHD,
it just shows what kind of shitty system we have
any impedance
in
to
terms
getting
of
the thing done.
trying to help people. And I think we're frozen again.
Me, you, I hear you. It might be frozen on your. Oh, maybe not.
I think we're frozen again.
But seems okay on my end. So anyway,
I cannot hear you, Reef.
okay, I hear you. If that makes you feel better.
I cannot hear you, Reef. There we go.
Yeah, I think that's on your end. It's fine on ours, so hopefully
Okay, I have to
we're
look
good.
at.
But I
Okay,
was
I
gonna
have to
say,
look.
as a person with severe ADHD, any impedance to like getting medical stuff done, you just won't do, right? So you
Mhm.
know, any extra paperwork like is a massive problem, you know. So like, I don't know, it's frustrating to say the least, you know, that this kind of stuff, like the minute you okay, I gotta call, get prescriptions put in, and oh well, your insurance isn't quite perfect. Well, let me call, let's see. Oh well, you missed the deadline to do this, and you didn't receive any information,
Mhm.
like, so yeah,
Well,
it's
not
just,
even that, but like insurance here is shit because
yeah,
like just as an aside, like when I was in Boston, I had one type of insurance. I have hay fever. I have seasonal allergies, so I would go to get Flonase through an subscription. Like so, with my insurance, at least with that insurance, I paid
yeah,
at the time was like $5 or something like that. Fine.
yeah,
Moved to DC, switched to another health insurance company, went to a pharmacy to get the same prescription. Again, this is seasonal allergies, and they're like, no, it's not covered. So now I have to pay full price to get the same medicine that initially I was paying with my insurance formerly $5 for. So it just makes no damn sense how insurance works in this country at all. So, but I mean, but yeah, I think some people are mentioning having that data possibly as a story. I think about it. I'll definitely might ask you guys for help with it as soon as I kind of tailor it with my group to figure out how we're going to do it. But I think it might be yeah, I think actually that might be a good exercise for people in terms of direct action locally. So yeah,
yeah.
I'll think about it and see how I can make that into maybe an ongoing segment here. So yeah, but thanks
Well,
guys, appreciate that. And yeah, those of you who are struggling, sorry, but yeah, like
expect more struggle, I guess.
right.